The content available on this podcast and on LoriWilliamsSeniorServices.com has been produced for educational purposes only. The contents of any episodes do not constitute medical, legal, or professional advice, do not reflect the opinions of this company, any of its parent companies or affiliates, and do not create any type of professional relationship between the audience, guest, and the host. No person listening to this podcast should act or refrain from acting on the basis of the content of a podcast without first seeking appropriate professional advice and/or counseling, nor shall the information be used as a substitute for professional advice and/or counseling. Joie Williams Senior Services, LLC expressly denies any and all liability relating to any actions taken or not taken based on any or all contents of this podcast. Welcome to Aging in Style with me, Joie Williams. I'm an optimist by nature, and I believe you can follow your dreams at any age. My grandmother's journey with dementia ignited a passion in me to work with seniors. I've spent the past 13 years learning about seniors and aging. In my mid-50s, I followed my own dream and founded my company, where I use my expertise to help seniors locate housing and resources. On this podcast, we cover all aspects of aging. Join us each week to meet senior living experts and inspirational seniors who are following their dreams. The fact is, we're all aging, so why not do it in style? Hi, welcome back for another episode. I'm so glad you're here. Today's show is all about essential oils. And essential oils are so popular these days. You see them in everything. And, if you're like me, you kind of wonder, how exactly do you use them? And I have kind of an interesting story. Oh, it's definitely an interesting story. Not kind of, it is interesting. It is. I was really congested a couple of weeks ago, and a friend of mine who is known as the essential oil guru told me, take peppermint oil and put it on the tips of your toes, and it immediately will make you not congested. And I thought that was kind of weird, but I was desperate to not be congested. So I put peppermint oil on the tips of my toes, and seriously, I was not congested instantly. It was amazing. So I am a huge believer in oils, and that's why I wanted to do this show today. And I have invited on the essential oil guru. Her name is Joie Bailey, and she is the owner of Essentially Spoiled, and she is a certified clinical aromatherapist. She has also worked with seniors for years and years and years, and she is just a really great resource. So welcome, Joie.
Hi, thanks.
I'm glad you're here.
Thanks for having me.
You're welcome. Thanks for decongesting me.
You're welcome. We can all breathe easy now.
Yeah, good stuff. So how did you get into oils and becoming the oil guru that you are?
Yes. Well, it all started when my daughter was having seizures. So I had a friend that brought oils to me to try for her seizures, because we had tried pretty much everything else, and she was on lots of medication and trying to get her to deal without seizures so she could get her driver's license. So it was before she turned 16. And oils started working with her. So we did chiropractic help and essential oils. And I started looking into, well, if they work for seizures, then how does this really work for the rest of your body? And dementia, being in the senior industry, I really kind of started digging into dementia and memory issues with oils, and then learning that there's actually a lot of studies that have been done on essential oils and dementia in the UK. That's when I thought, I want to learn more about this. So I went to school and got my certification in aromatherapy, and that's how I became clinically certified.
That's awesome.
Not crazy.
Well, now. So what is a certified clinical aromatherapist? What does that mean?
So it means that it's a person that makes blends and therapeutically uses essential oils for the therapeutic purpose of clinically improving any type of ailment or disease or process that your body's going through.
And I know I've seen your bag of oils, and I don't even know, how many oils are there? I mean, there's
Oh, there's thousands. I mean, there's lots and lots of oils. So many oils that you would be surprised as to. They come from plants, they come from barks of trees, they come from roots, they come from petals, they come from the little seeds in the petals. So lots of different ways that oil is extracted from the different parts of the earth, and that's why there's just so many different oils.
That's amazing. There's so many, because I think like most people, you think peppermint or lavender.
Right.
Those are probably like the ones that come to mind for most people. So that's interesting. And I've seen you do your blends. So that's what you learned how to do. And the blends are you blend certain oils together to create something that's going to solve someone's issue. Like I call it her witch's brew. When I see her brewing up some oils in that way.
Mixing it up.
That's right. So what are the top 5 oils? And I know you have a lot more, but what would you say the top 5 oils that everyone should have and why?
Okay. So my top 5 oils, I'll go through the top 5 and then I'll go back and say why. So the top 5 is tea tree oil, peppermint oil, lavender, rosemary, and lemon.
Okay.
So I pick tea tree oil is one of my top 5 because it's a cleansing oil. It is a cell generation oil. It's a healing oil. So anytime that like you have a cut, a scrape, a bruise, anything like that, then it will heal those cells a lot faster. Also, it's a good immune boosting oil. So tea tree oil is very good for immunity. And then peppermint, obviously for congestion
and headaches.
I
use it anytime I have a headache now.
Yes. And obviously as we're aging, we have some hormone situations, hot flashes. So when you put a drop of peppermint on the back of your neck, it automatically lowers your body temperature.
I can attest to that. And if your air condition goes out, as mine did this summer, put peppermint oil and a cool rag, and it cools you off.
It cools you off.
Yes.
I know. It's so crazy. It's crazy. But one thing with peppermint, remember, it also is a burning oil too. So it will burn your eyes if you get it too close to your eyes.
Yes,
which
it
we'll
will.
talk about safety
Yes, I've
later,
had that happen too.
Yes. So that's a reason that I like peppermint, because it does so many different things. And then I love rosemary, because rosemary is actually improves memory by 75%.
Wow.
Yeah.
There's some rosemary
studies that show that. Yeah, I know. I'm always like, where's the rosemary? I'm sorry, what was that again? So rosemary is definitely one that improves memory. Rosemary right now we're seeing helps a lot with smell and taste. And with COVID, a lot of people lose smell and taste. And so they're now learning that rosemary is helping you get that sensation back.
Oh, that's interesting.
So it's very interesting. But rosemary is one of my other ones. Lavender is my other essential oil that I love. Because it's another calming oil, lavender is an oil that I can use as an uplifting oil. It's also one that'll help you go to sleep, but it also will help you kind of relax in some of these anxious times that we're going through too.
Do you suggest like putting it on your pillow? I've heard people say that.
Yes, absolutely. I even have some people that they'll put it on a cotton ball, and if you just set it in your bedroom on a cotton ball, it will still fill up the air. So it will continue to fill your room. That's another way to do it. Some people kind of are like, I don't want to put it on my pillow because then I'm sleeping on it. And it may be a little strong if you just put lavender on your pillow directly. So you want to do like a lavender spray.
Oh, okay.
So there's different ways that you can put that into like an amber bottle or a colored bottle. You don't want a clear bottle, because with oils, if light hits it or heat hits it, it's going to make your oil less therapeutic. It's not going to work as well.
Okay, good to know.
Yeah. Yeah. And then lemon is my fifth oil. And that is because it's very cleansing. It's a clean oil. It also helps with allergies and stuffiness. So if you have a diffuser, you can diffuse peppermint, lavender, and lemon. Mm-hmm. That is my wonderful go-to, like, clean smell. It makes the house smell clean. But you can also use it for cleaning purposes. And you can put it in water, because it is used as a way to lose weight. Way to help
so you can
lose
actually
weight.
drink it.
You can actually drink it.
Oh.
So you can put a drop of lemon oil in your water a day, and it increases your metabolism.
I need some lemon.
Yeah. So that's why those are my top 5.
Wow. Well, and I know when I asked her to limit it to 5, that was very difficult.
It was.
So what we're going to do for you, Joey's going to send over a PDF with her top 10 oils, and I'm going to put it on my website so you guys can find it and see her top 10 oils. So all oils aren't created equally. So you could go to Sprouts and there's some sort of oil. You can find, they're so popular right now. Everyone's producing essential oils, but they aren't the same quality. So tell us how you find a good oil.
So when you are looking for an oil on the actual oil bottle, you want to make sure that it's in a darker colored bottle. So you'll notice that all the bottles, the good therapeutic pure oils, are dark. And then on the label, it will say 100% pure or 100% tested, or there's really not, if it says 100% therapeutic, really isn't 100% therapeutic, because oil is not really therapeutic until you use it. So it's more or less that you want to make sure that it's tested and that it says pure. Those are the 2 words that I look for on all my oil bottles.
Okay. And to ingest them, you need to make sure not all can be ingested.
Right. So to be ingested, I would actually ask an aromatherapist, get one that you know, or contact me through your website. You can ingest oils. I mean, like you've done our lovely peppermint lick.
That is really popular around this area. We've all done the peppermint lick, where you put a drop of peppermint on the back of your hand, and it helps with congestion.
It does. It helps. It also helps with energy. So if you're just dragging and you don't want to drink any coffee and you want a natural boost, then it's going to give you an energy boost as well. So, and clear those sinuses up. So,
yeah, it really does.
Yeah, it does. So, you can put lemon and water, peppermint, ingested. There's a lot of oils that you can use in cooking. So that's a way that can be ingested as well.
Okay. And you also have a tool that you use, and it can actually measure which oils the body needs and why. And we actually tried the tool out on me. It's called iTovi.
Yep.
Is that right? So we tried the iTovi scanner out on me, and it came back that my immune system, I needed oils to boost it, which is not unusual because it's allergy season here in Texas, and I'm always congested. So,
and it focused on your respiratory.
It really did.
So that made sense.
Yeah. I took a picture, and I'm going to be posting a picture of the iTovi scanner and how it looked, to put it on, to hold it, and then also what my results looked like when they came up. So, so that was interesting. So I immediately used some oils
Yes.
to boost my immune system, and I'll be putting peppermint on my toes tonight. Okay.
Good.
Very good.
You're learning well.
Yes, thank you. What else? What kind of things has the iTovi scanner picked up on people you used it on?
So it tells me what's going on in the body. It works just like a Fitbit or an iWatch. So you know how you can test your heart rate with an iWatch or a Fitbit. So it's very, very similar to that. And it will tell me if there's any kind of, like we found, your respiratory issues, any kind of digestive issues, things like that. So a lot of times I go in and I see patients and I'm thinking that they need a certain oil that we kind of generalize instead of individualizing it. So that's something that the iTovi scanner helps me with, especially when I'm working with some of my dementia patients that can't tell me what's going on with them. Then I can hold the iTovi scanner closer to their skin, and it will give me a reading of exactly what oils their body is going to benefit best from.
That is very cool.
Yeah.
Because they can't verbalize and tell you, hey, I'm not feeling good or whatever. So you can find that. Okay.
Yeah.
That's cool.
That's one thing that is very helpful, because otherwise I would just go in and I would think, oh, they have dementia, they need rosemary, they need frankincense, they need lavender. And a lot of times it's not just those oils, because that's generalized. You think rosemary for memory, frankincense for kind of frustration, things like that, and then lavender for anxiety. And I'm thinking, well, that's what I would do. That's just what I would use as a basic. But the iTovi scanner will give me exactly individualized what they're going through, because it could be a digestive issue that they're having, and they don't know how to explain that with dementia.
So if it's digestive, you can add, like, what oil is good for that?
Ginger. Ginger's great for that. And if you put ginger on a cotton swab or a Q-tip and put it in the belly button, then it is immediate result. So you're going to see.
So like if you're nauseous, would that be the thing?
That would be a great thing to do. Yeah.
That's interesting.
Anytime that you have any kind of nausea, or when you have a hangover, those are all great.
That would have been helpful to know in my college days.
Exactly. Too much wine, those things. Yeah.
What about if someone is pregnant?
If somebody's pregnant, ginger is safe. Peppermint is not safe, but there are other oils that you can substitute, which is why there's so many oils out there that you can choose from to kind of substitute out some different oils.
But again, why it's important to talk to a certified aromatherapist.
Yep.
To know that.
For sure.
Okay, very good. So what are the different ways that you can use oils? And I know we've touched on some of them with the peppermint lick and then the on a cotton ball, but what other ways do people use oils?
So you can inhale oils, you can ingest oils, and then you can topically apply oils. So inhaling oils is more, like you said, diffusing when you use a diffuser and it's in a room. I wouldn't use a diffuser any longer than about 30 minutes every 2 hours. 2 to 3 hours.
Oh, okay.
So if you have the diffuser going all the time, then you kind of get used to that smell, and it's not doing any harm, but it's not as effective.
Okay.
Yeah, perfect. Yep.
So like at night, because I know I was using mine for a while all night long. Is that okay to run it all night?
It's fine. It's not going to hurt you. It's just that it's not as effective, and then it may kind of start wearing off. You may start getting too used to it just being there, and so you might need to change some things up. You know how you just kind of get accustomed to the same thing and your body just kind of gets used to that? Well, you may not be utilizing it as effective as much.
Okay. And then topically, I know you have to use a carrier oil. And what are carrier oils?
So the carrier oils are something that's going to kind of dilute the oils, because oils are very, very, very strong. For example, in a bottle of peppermint. Let's just go with peppermint. So this bottle of 0.5 ounces of peppermint is going to be about 100,000 peppermint leaves that are extracted.
Oh my gosh.
Yeah.
That's a lot.
That's a lot.
Yeah.
And so in one drop. So that's a lot of oil. One drop of that is going to be very strong, right? So that's one reason why you want to use a carrier oil, because if you just were to put one drop of, let's say, frankincense on the bottom of your foot. I had a patient that she was having some pain issues, and she had somebody just tell her, oh, frankincense is great for pain. Put it on the bottom of your feet, because there's different reflexology points on your feet, which is why your toes worked really well for your congestion. But she put the frankincense on her foot and it burned without any kind of carrier oil, because it's a lot stronger. Then it wasn't able to dilute it a little bit. So the carrier oils are going to either help it dilute, or it's also their job is to carry it through your skin into your system so that they can work a lot better as well. So hence the reason carrier oil.
And that's like coconut
oil, almond oil, any kind of oil like that, jojoba oil, hemp seed oil, those grape seed oils, really good. Those types of things are really good. You can also put it with lotions, any kind of unscented lotion that has no other constituents in them, then you can put oils with your lotions as well.
Can you put it in your bath?
You can, put it drops in your bath. Eucalyptus is really good in your bath for a relaxing, and it also opens up your respiratory.
I think I have some eucalyptus.
Oh, there you go.
So how does frankincense work? That works for pain, you said?
Frankincense can work for pain at certain times, certain people. Ginger is really good for arthritis. Okay. If you put a drop of ginger with some I always say put it with a carrier oil until you can test it and see how your body's going to react. But you can put it directly on where your joint is that's hurting. So there's lots of different ways that these oils can be used.
Okay.
Yeah.
So we've touched on it already, but seniors and dementia. So seniors that have dementia,
right,
we're seeing lots of good results. And I know prior to COVID, I went into several memory care places and they were diffusing oils, which I was very excited to see. So tell us about oils and which oils you're seeing results for dementia, and maybe some examples of ones you've used.
So good oils for dementia are obviously rosemary. It's not going to bring back the memory, but it will stop the memory from where it's at. And it can bring a little bit back, but we're not going to be able to bring back far the long-term dementia. So those are some of the things. But then orange is another really good one because orange is a mood enhancer oil. So it's going to increase mood. With a lot of times dementia, like we said, it's hard for them to express what's going on. So that kind of tends to bring down the mood. So with orange, it's going to uplift the mood. I had a family member that she was having a difficult time passing in hospice. And so we were talking to the family, finding out that her comfortable place was on an orange farm. And that's kind of where she grew up with oranges, and so the smell of oranges gave her comfort, and therefore she was able to pass and so forth.
So that calmed her down, gave her a peaceful feeling.
Yeah. It was kind of a memory that comes back, and that's kind of how essential oils work. So we have a place in our brain that, not to get too technical, that once you smell, it goes to that olfactory nerve and it will generate the limbic system, which is the system that invigorates our memory, smell, taste, all of our different senses that we have.
That's very cool.
Yeah.
And also, with people with dementia, there's a lot of anxiety. So you do a lot of oils for that as well.
Absolutely. Yeah. So, for example, a gentleman that was in a dementia secured unit, he hadn't spoken in probably, I can't remember exactly the time frame, how it had been, but he hadn't spoken words very long. And we were doing some oils with some of the other residents in the memory care unit. And he walks over and says a full sentence. That smells amazing. And we were all like, whoa, hi, who is this? And so it was an oil that had just generated a moment for him. So that's something that oils are able to do if it's pure and we're using good oils, and so then that's truly
amazing. And using oils with dementia, it's fairly new. So I think we're going to see more and more use of it and learn more about how we can use it and the benefits of it as time goes on. So we hear that oils are not safe around dogs.
Right. Yes.
So which ones, what safety precautions should we take?
So I would contact an aromatherapist if you have a pet or an animal that you don't know. The only reason is because animals just don't digest the same way that humans do. So even though their smell is a lot stronger than ours, obviously, right? So when they smell something, then it goes straight to their liver, and their liver just can't process it. So that's why they always say tea tree oil you can't diffuse around a dog. You can't diffuse them around cats, things like that. So you just want to make sure that you're being very cautious about what oils you are diffusing, how often you're diffusing them, and how long you're diffusing them.
Okay, that's good to know. What other safety precautions should we take? I
would definitely just make sure that you are using your carrier oils. Make sure that you are using good pure oils. If you're going to be using them therapeutically purposes. If you're using them for just smell, it's not that big of a deal. You want to make sure that you keep them in a dark, cool space. So you don't want them to get overheated. You don't want them to reach light. Every time that an oil sees light, it loses some efficacy. So it's not as strong every time that oil is opened up, that bottle's opened up. So you want to make sure that you always keep your lids on. You can keep oils in the refrigerator. I know a lot of people that keep their oils in the refrigerator because it does keep them longer. I've been asked as well, do oils expire? They do have an expiration date, but it doesn't mean that they're not good any longer. It just means that they're not going to work as well. So
they
you
lose
just
a
don't
little
want
bit
to,
of their potency.
Yes. Yeah.
Okay. Good to know.
Yeah.
I think this is kind of this will be a good question, maybe a loaded question, but
yes, loaded.
With COVID, the stress of COVID and the stress of the election is all we're going to say on that. Everyone's anxious.
Yeah.
So what would you say is a good oil to use to help with anxiety?
So I really have been diffusing a lot of Anise myrtle.
What is it?
It's ANISE myrtle, MYRTLE. So it kind of is it's a little bit of a licorice cinnamon smell, kind of. It's used a lot in cooking. I will say that is something that's used a lot for cooking, but when it's also a anti-anxiety oil. Orange is a really good anti-anxiety oil. Lavender obviously is a good. Any citrus oil is a really good anti-anxiety oil because it's a mood enhancer. So when you're blending those in a diffuser, I wouldn't go any more than 5 oils at a time. Anything from 3 to 5 oils. Once you get too many oils, then it's just not going to work as well. You're going to start losing the efficacy of the oil, and it's going to be too much and too overwhelming. So you're definitely going to want to make sure to keep those around 3 to 5.
When you put oil in a diffuser, how many drops do you put in?
Depending on the size of the diffuser.
Okay.
So that's the other thing is that you want to put, usually I'm going to say a typical average size of a diffuser is you're going to put 3 to 5 drops of each oil in the diffuser.
And putting more isn't necessarily what you need to do.
No.
I tend to find myself...
Is not always better.
I know. I find myself going like, okay, there's 10. Oh, maybe 15.
No.
You know?
And actually, less is stronger. So if you think about it, remember how much it takes to do an oil. I mean, like, for example, sandalwood comes from an 80-year-old tree. And it's better the older the tree is. So if it's a 100-year-old tree, then it's a stronger oil, right? So you don't have to get as much off of that sandalwood to make it that strong. So one tiny little, very thick drop of sandalwood is much stronger than 5 drops of sandalwood.
Interesting,
right?
Good to know.
Yeah.
Well, thank you so much, Joie, for coming here and sharing your knowledge. We're going to have you back because I know we could talk forever about oils and how to use them. And I hope that this has been helpful for everyone. I find it fascinating, especially because every time you turn around, you're seeing more and more things about oils. And, you can find oils at CVS or they're
everywhere.
They're everywhere. And it does make you wonder, okay, what is the best kind to use? So you want to use the right oils. So we are going to have all of Joie's contact information after the podcast. You'll be able to reach her. Her company is Essentially Spoiled. So we'll have all of her contact information plus the PDF she's going to send us on her top 10 oils that Joie recommends. So I hope y'all have enjoyed the show. And as always, thank you so much for listening. And go over to Apple Podcast if you haven't already and leave us a review. And if there's some sort of information we've not covered that you'd love to learn more about, just drop me a line. Thanks for listening, and we'll see you next time. Bye.